Hi, I'm Brianna Oberlin, and I'm a registered dietitian and certified diabetes care and education specialist. When you have diabetes, one of the most important things to do is monitor your blood sugar levels or blood glucose. Checking your blood sugar will help you to understand how food, exercise, medication, and stress can impact your blood sugar levels. Managing your blood sugar levels significantly lowers your risk of developing health-related issues and improves your quality of life. Testing your blood sugar at home helps you to see how different foods, physical activity, different medicines, and other factors affect your levels. Keeping track of these results helps you see patterns over time and can help you and your healthcare provider achieve your diabetes goals. All home blood sugar testing machines, called glucometers, require a drop of blood to be applied to the test strip. These items are typically covered by most insurance plans, but different insurance plans will cover different devices. Ask your doctor for a generic prescription to ensure you get the insurance-preferred glucometer. Blood sugar targets should be individualized for the person and their unique situation. Talk with your diabetes provider about what your target should be. Here are some general tips for blood sugar testing with your glucometer. Wash your hands with warm water and soap. Hand sanitizer won't get your hands as clean as soap and water. Insert a new lancet into the lancing device. Each brand of lancet is slightly different, so please refer to the instructions that came with your device for details. You might need to remove a protective cover to expose the needle. You may also need to remove a lancet from the last time the device was used. We will explain how to discard the used lancet later in this video. Remember to use a new lancet every time you check your blood sugar. Insert a new test strip into the appropriate slot on the glucometer. This should turn the device on. Set the device aside for a moment. Ready the lancing device and put the end against your finger. Be sure to poke the side of your fingertip and not the pad in the middle of the finger to draw a drop of blood. Don't use your thumb to test. It is not recommended to check your blood sugar on other parts of your body when your blood sugar could be very high or low, as it may not give you the most accurate results. We recommend talking to someone on your healthcare team before using an alternate testing site for checking your blood sugars. For getting the best drop of blood, gently milk or squeeze your finger from below the knuckle to the tip. Also keep your hand below the level of your heart while the drop appears. If you find that a gentle squeeze does not produce enough blood, increase the depth of your lancing device to poke a little deeper rather than squeezing your finger harder. Touch the receiving slot of the test strip to the liquid drop of blood. The test strip will absorb the blood. The glucometer will display the result. Keep track of this information. It's important to keep track of your blood sugar test results and bring them to all of your appointments with your healthcare team. You can use a written logbook, an app on your phone, or another record-keeping device. Some providers may even have a way to directly upload the data from your glucometer or other diabetes monitoring devices. Ask your care provider if this is an option at your local clinic. It's also important to know that you should never use someone else's monitoring equipment or share your own equipment with someone, even if they're a loved one. It is dangerous and illegal to dispose of needles, lancets, and syringes in your regular garbage or recycling container. These items, often called sharps, need to be disposed of properly to reduce the risk of injury to yourself and others. Check with your local government's solid waste division for information on sharps disposal in your local area. The following guidelines will help keep you and others safe when handling sharps. Always place used sharps and syringes in a safe container, such as a manufactured sharps disposal container. These are available at most pharmacies. Do not flush needles, lancets, or syringes down the toilet. If you find a syringe or needle laying around, do not pick it up with your bare hands. Use a glove and tongs, a shovel, or a broom and dustpan to pick it up. Remember, the good news is that your diabetes can be managed. You have the most important role in caring for your diabetes. You can take steps to stay healthy and prevent complications of diabetes. Knowing your blood sugar levels will help you to achieve this goal. This video and others in this series are meant to cover basic but important diabetes self-management practices. For more in-depth information and guidance, find out if there is diabetes education available in your area. If there is, ask your healthcare provider for a referral to this service. Diabetes education is covered by most insurance companies. Out-of-pocket costs can vary depending on your specific insurance coverage, copay, coinsurance, and deductible. For specific coverage and costs, please contact your insurance company. To learn more about local resources and support systems, reach out to your diabetes care team.